Welcome to our compliance tip video addressing medical necessity, presented by the American Institute of Healthcare Compliance. Today's program is contents of a local coverage determination and complying to medical necessity rules. First, it's important to know how to locate Medicare's medical review policies. Now, today we're specifically going to talk about Medicare, but you need to follow the medical review policies for any particular insurance company, Blue Cross Blue Shield, Cigna, and so forth, on their particular websites. LCDs and NCDs, National Coverage Determinations, can be located through the National Centers for Medicare and Medicaid Services website, as well as from your MAC website. Today we're going to use a Medicare Administrative Contractor Palmetto GBA local coverage determination, and the one chosen as an example for today is L36471 for facet joint injections, medial branch blocks, and facet joint radiofrequency neurotomy. Now, after searching North Carolina for applicable LCDs related to facet joint injections, I found this information. If both of these, the LCD and the article, applies to your situation, you're going to want to open and reference both. Today we're going to look at the LCD 36471 for facet joints and the Medicare Administrative Contractor is Palmetto. First, we want to verify the LCD and the MAC, as well as the effective date of the LCD compared to the patient's date of service that we're going to file on the claim. Now, what I did is I took a snippet showing the local coverage determination. It says facet joint injections, medial branch blocks, facet joint radiofrequency, and the number here is L36471. The original effective date was February 15th of 2016, but it's been updated. And the LCD that we are going to review parts of today are applying to services performed on or after July 11th of 2019. I like to start off dissecting the LCD, very pertinent parts, and comparing it to the patient's record, starting through using an algorithm with all of my reviews for medical necessity when using an NCD or LCD. I like to start off with the indications. It provides valuable information related to the medical necessity of the claim. So in this particular facet joint injection LCD, it says the patient must have a history of at least 3 months of moderate to severe pain with functional impairment and pain inadequately responsive to more conservative care, such as non-steroidal anti-inflammatory drugs, or NSAIDs, acetaminophen, or physical therapy. So that has to be documented in the record. And if it isn't, I know that chances are, as I proceed, I may not meet all of the requirements for medical necessity. The pain is predominantly axial and, with the possible exception of facet joint cysts, not associated with radiculopathy or neurogenic claudication. There is no non-facet pathology that could explain the source of the patient's pain, such as a fracture, tumor, infection, or significant deformity. And the documented clinical assessment needs to implicate the facet joint as a putative source of pain. Now, the next thing I look at if there's anything in the LCD regarding provider qualifications. And in this particular LCD, there is. It is important to follow the training requirements, and it applies only to the providers who have not provided these specific interventional pain management services on a regular basis, or at least 2 times per month, during the 10 years prior to the effective date of the LCD. So this is a little bit complicated. You may have to query the doctor or ask the provider more information to see if they qualify. A basic requirement of payment is training and credentialing by a formal residency fellowship program and or other training program that is accredited by a nationally recognized body and whose core curriculum includes the performance and management of the procedures addressed in the policy. If the practitioner works in a hospital facility at any time and or is credentialed by a hospital for any procedure, the practitioner must be credentialed to perform the same procedure in the outpatient setting. Then I like to look at the limitations of coverage. So if I've met the indications, the provider meets any restrictions and qualifications, then I like to look at the limitations. There has to be a maximum of 5 facet joint injection sessions, inclusive of medial branch blocks. Intra-articular injections, facet cyst rupture, ablations may be performed per rolling 12-month year in the cervical thoracic spine and 5 in the lumbar spine. So this is very, very specific. So you're going to need to dissect the documentation, look at prior records. For each covered spine region, no more than 2 thermal RF sessions will be reimbursed in any rolling 12-month year, involving no more than 4 joints per session, 2 bilateral levels or 4 unilateral levels. And it goes on about conscious sedation and non-thermal modalities. So you need to go through the entire patient's record and make sure that if your claim were audited, the auditor and reviewer would be requesting all of the pertinent pieces of information. Now, when it comes to effective appeals management, if a claim for facet joint injections and radiofrequency is denied or in question, or you need to appeal it, make sure that you provide the documentation that supports all of those indications and all of these limitations. Because if they're going to have their little checkbox, and it's important for you to have your little checklist to make sure that the documentation meets all of the requirements, not just some of them.
Consider learning more about healthcare compliance with the American Institute's online on-demand training courses. Visit our certification store. Check out short courses and webinars. Both links are provided in this video's description below. Questions? Contact us 330-241-5635 or visit our website www.aihc-assn.org.